Johns Hopkins study saying COVID-19 has relatively no effect on deaths, and U.S. spiked after publication. Now, you think about that headline, says it all. Conventional wisdom is that COVID-19 has caused thousands of deaths in the United States and nearly 1.5 million worldwide. This perception has been directly challenged by a study published by Johns Hopkins University on November 22nd. Genevieve Briand, Assistant Program Director of the Applied Economics Master's Degree Program at Johns Hopkins University, critically analyzed the impact that COVID-19 had on U.S. deaths. According to Briand, the impact of COVID-19 on deaths in the United States can be fully understood by comparing it to the number of total deaths in the country. According to the study, in contrast to most people's assumptions, the number of deaths by COVID-19 is not alarming. In fact, it has relatively no effect on deaths in the United States. But you wouldn't think that by watching the news. Continuing, after retrieving data on the CDC website. Now, that's what blows my mind. Where is this Briand getting the information? Right from the CDC. Can't make this up. Briand compiled a graph representing percentages of total deaths per age category from early February to early September, which includes the period from before COVID-19 was detected in the U.S. to after infection rates soared. Surprisingly, the deaths of older people stayed the same before and after COVID-19. Since COVID-19 mainly affects the elderly, experts expected an increase in the percentage of deaths in older age groups. However, this increase is not seen from the CDC data. In fact, the percentages of deaths among all age groups remain relatively the same. According to Briand, the reason we have higher number of reported COVID-19 deaths among older individuals than younger individuals is simply because every day in the U.S., older individuals die in higher numbers than younger individuals. Analysis of deaths per cause in 2018 revealed that the pattern of seasonal increase in the total number of deaths is a result of the rise in deaths by all causes, with the top three being heart disease, respiratory diseases, influenza, and pneumonia. This is true every year, explained Briand. Every year in the U.S., when we observe the seasonal ups and downs, we have an increase of deaths due to all causes. Now listen to this. This is where this article gets really interesting.